anterior and posterior triangle. The neck region encloses between the head and the thorax or thoracic cavity, and it has a superior and inferior boundary. Actually, superior boundary of neck is formed by external occipital protuberance, superior nuchal line, and if you move to forward, you can see mastoid process and inferior border of mandible bone. But the inferior boundary of neck is formed by a supraesternal notch, clavicle, acromion process, and finally at the posterior terminate to spinous process of C7. So the superior boundary of neck is formed by inferior border of mandible, mastoid process, and external occipital protuberance. An inferior boundary is formed by supraesternal notch, clavicle, acromion process, and spinous process of C7. Deeper to skin, there is a superficial fascia, and the superficial fascia in the neck contain platysma muscles, contain the superficial nerves and vessels. At first, I explain about the platysma muscles. This is the platysma muscles. These muscles originate from skin of pectoral region or pectoralis fascia, and inserted to lower border of mandible and lateral corner of mouth, and the fiber of platysma interdigitate to facial muscles. The platysma muscles innervated by facial nerve. This is the motor innervation, and it's innervated by sensory nerves, for example, supraclavicular nerves, transverse cervical nerves. These are branch of cervical plexus. When the platysma contracts, leads to wrinkles on the skin of neck region. Deeper to platysma, there is a external jugular vein. This is the external jugular vein. This vein forms by posterior auricular vein and posterior branch of retromandibular vein. Inferior to external acoustic meatus, posterior auricular vein joined to posterior branch of retromandibular vein, and forms the external jugular vein. You can see external jugular vein passes to lateral or anterior surface of SCM muscles or sternocleidomastoid muscles. This is the posterior auricular vein. This is the superficial temporal vein and maxillary vein join together and forms the retromandibular vein. After that, the retromandibular vein is divided to anterior branch and posterior branch. Posterior branch of retromandibular vein joined to posterior auricular vein. After that, forms the external jugular vein. But the anterior branch of retromandibular joined to facial nerve. This is the facial nerve and forms the common facial nerve. This is the common facial nerve produced by anterior branch of retromandibular vein and facial nerve. About clavicle, external jugular vein pierces the superficial fascia in the neck and finally it goes to deeper area and drain to subclavian vein. This is the subclavian vein. So the external jugular vein finally drain to subclavian vein. Please look at this picture. This is the external jugular vein produced by posterior auricular and posterior branch of retromandibular vein. After that, the external jugular vein above the clavicle drain to subclavian vein. In this direction, it has it collects the venous blood from the transverse cervical vein, from the suprascapular vein, and from the posterior external jugular vein. This branch or this vein drain to external jugular vein. This is the external jugular vein. In this direction, collects or receive the several veins. For example, transverse cervical, suprascapular, and posterior external jugular vein, and drain to external jugular vein. Another vein is located in a superficial fascia in the neck. Is the anterior jugular vein. This is the anterior jugular vein. Left and right, anterior jugular vein. About supraesternal notch, a left and right jugular vein join together and forms the jugular arch. This is the jugular arch. Because of this vein, the name of jugular notch is a the name of a supraesternal notch is a jugular notch because of this arch. Anterior jugular vein forms by submental vein and submandibular vein join together and forms the anterior jugular vein. And finally, anterior jugular vein drain to external jugular vein, and it has a communication with the external jugular vein. In superficial fascia, there are different structures, for example, platysma, Deeper to platysma, you can see external jugular vein and anterior jugular vein. And finally, there is a cutaneous branch of cervical plexus. You know the cervical plexus is formed by C4, C2, C3, and C4 ventral rhombs of spinal cord. This ventral spinal cord join together and forms the cervical plexus. This plexus has a muscular branch, for example, phrenic nerve, innervated the diaphragm muscles, or forms the ansa cervicalis. This is the ansa cervicalis, innervated the infrahyoid muscles, and forms a sensory branch, for example, lesser occipital, greater auricular, transverse cervical, and supraclavicular nerve. These nerves are sensory branch. Actually, the cutaneous branch of cervical plexus include the four branch: greater auricular branch, lesser occipital branch, transverse cervical branch, and supraclavicular branch. In this picture, you can see a lesser occipital nerve goes to mastoid region and goes to posterior part of scalp. This is the sensory nerve and supply the sensory innervation for mastoid area. This is the greater auricular branch, divided to three branches: facial branch, auricular branch, and mastoid branch, and supply the sensory innervation for mastoid part, lobule of auricle, and part of the skin of face. Another branch is the transverse cervical. Transverse cervical nerve is divided to superior and inferior, and supply the sensory innervation for anterior neck skin, and supply the innervation for skin of anterior part of the neck. And finally, the last branch is a supraclavicular branch. It's divided to posterior, middle, and anterior branch. Supply sensory innervation for skin of clavicle, skin of shoulder joint, and skin of anterior part of the pectoral region. In this picture, you can see a lesser occipital nerve, greater auricular nerve, transverse cervical nerve, and supraclavicular nerve. It has a tree branch. This part is very, very important, and you should know the greater auricular nerve is formed by C2 and C3. Lesser occipital nerve is formed by C2. Transverse cervical nerve is formed by C2 and C3, similar to greater auricular nerve. But the supraclavicular nerve is formed by C3 and C4 rhombs. Deeper to superficial fascia, there is another fascia is called deep fascia. Deep fascia has a superficial part and deep part. Superficial part or investing layer encloses the different part of the neck. This is the investing layer. This is the transverse section of the neck. You can see a cervical vertebra and you can see skin and superficial fascia. Deeper to superficial fascia, you can see a blue part as a deep fascia, actually as a investing layer. Cover all different part of the neck anteriorly and posteriorly. For example, this is the SCM muscles, sternocleidomastoid muscles, and this is the trapezius muscles. Investing layer near the SCM muscles and near the trapezius muscles divided two layers and covered these muscles at the anterior and posterior, but in the other region of neck it consists of one layer. In this lateral part it consists of one layer, but at the anterior and posterior investing layer is divided two layers and encloses the SCM and trapezius muscles. Deep fascia consists of four parts. Investing part, prevertebral part is a pink part, pretracheal part, and this is the carotid sheath. It's different part of the deep fascia. Investing layer cover the trapezius muscle and SCM muscles. Carotid sheath is a purple part. It's here. Carotid sheath cover the internal jugular vein, vagus nerve, and common carotid artery. And prevertebral fascia is the pink part, covers the cervical vertebra and pre and paravertebral muscles, and continues in the upper limb or upper extremity as an axillary sheath. This is the pretracheal layer. Pretracheal layer or pretracheal fascia covers the trachea, esophagus, and parotid gland in the neck. This is the trachea and thyroid gland is covered with pretracheal fascia. This fascia. And the blue part is the investing part of deep fascia. There is a space between the investing layer and the pretracheal layer as a pretracheal space. In the neck continues to the thoracic cavity and terminates to superior mediastinum. This is the vertebral column. It's covered with the prevertebral fascia. It's the pink part. And the pretracheal fascia at the posterior to esophagus is changed to buccopharyngeal fascia. Actually, posterior part of the pretracheal fascia is called buccopharyngeal fascia. There is another space between the buccopharyngeal fascia and prevertebral fascia. It's called retropharyngeal space. Since the retropharyngeal space continues to posterior mediastinum, and if there is an infection in the thoracic cavity in posterior mediastinum, can be entered to the neck region by retropharyngeal space. There is a muscle in the lateral part of the neck. It's called sternocleidomastoid or SCM. Sternocleidomastoid. SCM muscles originate from clavicle, 1/3 of clavicle, and sternum. And finally, inserted two mastoid process and superior nuchal line. So the SCM muscles has a two head, sternal head and clavicular head. Both subhead join together and forms the SCM, and finally inserted to mastoid process. The location of SCM in the neck is very, very important because near the posterior borders here, there is a location for exit of different sensory innervation for lesser occipital, greater auricular, transverse cervical, and supraclavicular nerve. This point is located at the midpoint of posterior border of SCM, and its location for sensory innervation blockage in this in some surgery. SCM muscles maybe act for anterior scalene muscles, and so leading to neck flexion. But the main function is a lateral flexion of neck and rotation of face to opposite side. If the one SCM muscle in the neck contract, leading to the same lateral flexion in the neck and rotation of face to opposite side. Torticollis is a torsion in the cowl or neck, and is congenital anomaly for fiber of SCM muscles, and it's maybe happen during the birth, and it may occur due to different birth situation, and the fiber of SCM muscles leading to a spastic contraction, and the neck position in the lateral flexion and rotation for the face is fixed for patient. Because of location of SCM muscles in the neck region divided to anterior triangle and posterior triangle. Actually, the anterior triangle encloses between inferior border of mandible, superiorly, the midline plane, anteriorly, and the anterior border of SCM muscles posteriorly. This is the anterior triangle. And it has different muscles. The green part is the anterior triangle, and the blue part is the posterior triangle in the neck. But the posterior triangle, as a blue part, terminate to posterior border of SCM muscles anteriorly, terminate to anterior border of trapezius muscles posteriorly, and terminate to middle third of clavicle inferiorly. This is the posterior triangle in the neck. This is posterior triangle, and this one anterior triangle. But you can see special muscles as omohyoid muscles contain of superior belly and inferior belly. And inferior belly of omohyoid passes inside the posterior triangle and divided to posterior triangle to two triangles. Small triangle and the large triangle. This is the occipital triangle, and this one is a supraclavicular triangle. And superior belly of omohyoid muscle passes the anterior triangle and subdivided to carotid triangle and muscular triangle. This is the posterior triangle. It has a boundary, posterior border of SCM muscles, anterior border of trapezius muscles, and middle third of clavicle. This is the boundary of posterior triangle, and it has a floor and roof. Roof of posterior triangle consists of investing layer, and floor of posterior triangle consists of the sphenoid muscles, levator scapular muscles, and scalene muscles. Let's look at the floor muscles. It forms the posterior triangle. This is the levator scapula muscle, originate from transverse process of C1 to C4, and finally inserted to superior angle of scapula. This is the sphenoid muscles, originate from mastoid process and superior nuchal line, and inserted to ligament of nucha and spinous process of cervical and thoracic vertebra. But there are three scalene muscles: anterior, middle, and posterior scalene muscles produces the floor of posterior triangle. This is the levator scapula, sphenoid muscles, levator scapula muscles, posterior scalene, middle scalene, and anterior scalene muscles forms the floor of posterior triangle. The anterior scalene muscles originate from transverse process of C3 to C6 and inserted to first rib, inserted to a scalene tubercle on the first rib. The middle scalene, this is the anterior scalene, inserted to first rib at the scalene tubercle, and you can see a phrenic nerve passes anterior to